All right, let's talk. For, decades, we've all played by the rules, right? Get this checkup, do that screening. You did the right thing. You trusted the system. But what if I told you that once you hit 70, the whole rule book gets thrown out? And what if some of those tests that are supposed to keep you safe are actually playing with your health? Sounds wild, but it's a hidden truth most doctors will never tell you. New studies reveal that a staggering 37% of medical tests in seniors lead to unnecessary treatments, scary complications, or lifelong side effects. And get this, 99% of people over 70 have no idea they're being overtested. Every year, millions of seniors line up for these checkups thinking they're staying safe, but what if it's pushing them closer to surgery, stroke, or even cancer? One test on our list is so overused. Research suggests it might be responsible for up to 5% of all cancer cases in the U.S. That's equal to the number caused by drinking alcohol every day. You won't see that on a billboard. Today, we're pulling back the curtain on 5 routine checkups you should seriously question after 70. This isn't scare tactics. It's science, and you won't believe what made it to number 1. Number 5, the routine bone density scan. It sounds so harmless. A quick scan, no pain, no needles, and you walk out knowing your bone strength. It's called a DEXA scan, used to detect osteoporosis. But here's what no one tells you. Past the age of 70, this test can often create more fear than benefit. The results almost always come back showing lower density, but that's because bone loss is a natural part of aging, just like wrinkles or gray hair. It happens to everyone, and yet, many seniors get pushed into taking medications like bisphosphonates, which are supposed to strengthen bones but come with serious side effects like jaw necrosis, a rare condition where the jawbone starts to die, and esophageal irritation. Now, here's the real problem. Studies have shown that treating mild bone loss in people over 70 with medication has little to no impact on actual fracture rates. A study published in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found that bisphosphonates reduced fracture risk by only 0.3% after 5 years. That's not nothing, but it's far from life-saving. Instead, those women were far more likely to suffer from medication side effects, including digestive issues, inflammation, and brittle bones that break in odd ways. Let me tell you about Rose, a 76-year-old retired piano teacher. She was referred for a DEXA scan after her annual checkup. She had never had a fall, no pain, and walked daily. Her scan came back showing osteopenia, which is just a mild reduction in bone density. Her doctor immediately started her on a medication. 3 months in, she developed severe reflux and jaw pain. By the time we saw her, she hadn't played piano in weeks. We took her off the meds, started her on a regimen of vitamin D, weight-bearing exercises like resistance bands, and a calcium-rich diet. A year later, she was back to performing with stronger legs, better balance, and 0 fractures. A quick scan may seem smart, but for people over 70 who aren't falling, the better option is lifestyle. Strength training, balance exercises, and proper nutrition have been shown to reduce fractures by over 20%. Don't let a number on a screen scare you into treatment you may not need. Next up, number 4, the brain MRI for memory loss. When seniors feel more forgetful, the natural impulse is fear of dementia. So, doctors often respond by ordering a brain MRI. But here's the uncomfortable truth. These detailed scans rarely give the answers patients are hoping for. In fact, most MRIs in people over 70 simply show age-related changes, slight shrinkage or white matter spots that are totally normal in older adults. But here's the kicker. Once those spots are seen, they can trigger a cascade of fear, further tests, and even surgery that may not improve memory and can actually make things worse. In 2021, a study published in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85 who had mild cognitive complaints. 86% showed some form of brain abnormality, but only 3% of those findings were linked to an actual treatable condition. That means 97% of people went through the emotional toll of hearing, "There's something wrong," when really there wasn't. Worse, nearly 12% were sent for invasive procedures like spinal taps or even exploratory biopsies based on vague scan results. Take George, a 74-year-old retired engineer. He was sharp but misplaced his keys more often. His doctor sent him for an MRI that showed white matter changes. He panicked, convinced he had dementia. He stopped driving, stopped going to church. His anxiety worsened. But when we reassessed him, his cognitive score was well within the normal range. We explained those findings were age-appropriate. We helped him focus on sleep, hydration, and brain games. Within 3 months, his memory had stabilized. The truth is, unless there are severe symptoms like seizures or rapid decline, an MRI is rarely helpful. A better first step is a simple, cheap, paper-based cognitive test. It avoids the risk of unnecessary panic. All right, number 3, the cardiac stress test. It's one of the most common tests given to seniors complaining of mild fatigue or chest tightness. You're on a treadmill or given meds to simulate exercise, all to spot blocked arteries. But after 70, this test often does more harm than good. The problem is in the accuracy. Studies show that in adults over 70, the false positive rate can be as high as 40%. That means the test says there's a problem when there isn't one. That leads to follow-up tests like angiograms and even unnecessary stent placement or bypass surgery. In 2017, a major study in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no real symptoms or benefit. And those patients had no improvement in survival. What they did have were higher rates of bleeding, kidney injury from contrast dyes, and prolonged hospital stays. This happened to Raymond, a 75-year-old retired postman who walked every day. He mentioned he sometimes felt tired on hills. His doctor scheduled a stress test. The results were unclear, so he was sent for a catheterization, a tube into his arteries. A mild narrowing was found and a stent was placed. But that night, Raymond had a reaction to the contrast dye and developed kidney problems. He spent 6 days in the hospital. The fatigue never changed because it wasn't a heart problem. He was simply an older man who needed better hydration. If you're over 70 and not experiencing classic cardiac symptoms, a stress test may do more harm than good. A safer option is often a resting EKG or a coronary calcium scan. Number 2 is a big one, the routine screening colonoscopy. You probably didn't expect this. For most adults, it's a lifesaver. But after age 75, the conversation needs to shift for most people. The risks go way up. The preparation is harsh, involving strong laxatives that can cause dehydration, dizziness, or kidney issues. The sedation poses added risks to brain function, and the procedure itself can cause complications like bleeding, tearing, or even heart rhythm disturbances. A massive 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. They found that for every 1,000 colonoscopies done in patients over 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. And even when polyps are found, many are small and slow-growing. Removing them in an older adult can sometimes do more harm than leaving them alone. This happened to Dana, a 73-year-old grandmother with no symptoms and no family history. Her new doctor urged her to get a screening colonoscopy. She agreed. During the procedure, a small polyp was removed. That night, she had intense abdominal pain. At the hospital, they found a bowel perforation. She spent 9 days in recovery, lost 10 LEBs, and hasn't been the same since. The U.S. Preventive Services Task Force recommends stopping routine screening at 75 for most people. For those in excellent health, a stool-based test like the FIT test, a non-invasive fecal test done at home, is a safer option. It has no prep, no sedation, and still catches most concerning cases. And now, the #1 most overused and dangerous checkup, the annual full-body CT scan. These are sometimes offered as executive health packages, marketed as the ultimate way to catch cancer early. But here's the shocking truth. These scans expose your body to a high dose of ionizing radiation. Each scan delivers between 10 to 20 millisieverts, which is equal to around 500 chest X-rays. According to a 2023 study in JAMA Internal Medicine, the rise in CT scans may now be responsible for up to 5% of all cancers, putting them on par with alcohol as a cancer-causing factor. That means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. The scan detects harmless nodules, calcifications, or cysts that are simply part of aging. But the moment they are seen, a red flag goes up. More scans follow, then biopsies, then panic. Let me tell you about Marcus, an active 80-year-old who felt great. He took part in a senior checkup at a private clinic. His full-body scan showed a tiny 3-millimeter nodule. It set off a chain reaction. He was sent for a PET scan and eventually a needle biopsy. The result was benign, but the biopsy collapsed part of his lung. He was hospitalized and had a 2-month recovery, all for something that could have been left alone. Experts are clear. Full-body CT scans should never be used for general screening. The American College of Radiology says there's no proven benefit and significant potential for harm. If there are symptoms, targeted imaging makes sense. But scanning the whole body with no focus is like searching for treasure with a landmine detector. You may find something, but the damage could be worse. So there you have it. 5 health strategies that after 70 might be doing more harm than good. From bone scans and MRIs to stress tests, colonoscopies, and full-body CTs. The common thread? A one-size-fits-all approach to medicine just doesn't cut it as we get older. Now, the point isn't to tell you to ignore your doctor. It's the opposite. It's to empower you, to give you the latest evidence so you can be an active partner. It's about shifting the focus from just living longer to living better. If you take one thing away, let it be this. You have the right to ask questions. You have the right to understand the risks and benefits of every test as they apply to you. The best medical decisions happen when you and your doc have a real conversation and decide on a path together. Thanks for sticking with us on this important topic. If this info was helpful, do me a solid and hit that like button. And definitely subscribe to the channel for more straight talk to help you live a healthier, more informed life. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test that turned out to be unnecessary? Share your story in the comments below. Your experience could help someone else. Stay safe, stay informed, and we'll see you in the next video.